Hey everybody, I'm Dr. John Willardson, and today we're looking at a new patient consultation. When we get a new patient, we like to evaluate the CAT scan and determine the available bone. In this case, we're going to have to remove the remaining teeth. You can see a lot of the defects in the bone here. I've delineated the inferior alveolar nerve, so I know exactly where the nerve is to avoid hitting that nerve, to avoid having paresthesia or numbness. So we like to identify all the anatomy so that we can properly diagnose, plan, and treatment plan this case. And this case comes with some challenges, we'll call them, not complications, just challenges. You'll notice in the back of the upper jaw here, the posterior maxilla, if we were to place an implant in this area, you can see how this is air, so this dark area is space, and so there's no bone here. So in order for me to place like a 5 by 13 millimeter implant, I would need to do a sinus graft or a subantral augmentation in order to support that implant. And so as we're preparing and planning these cases, we want to know exactly where all the anatomy is. We want to know exactly the diameter and placement of each implant, as well as angulation. You notice here I can change the dimensions of the implant. I can change the length, the width, position. I can rotate it however I want to. And so this affords me the ability to be able to create and develop a treatment plan that protects the patient. It protects their investment, it protects the longevity of their case. This patient has already had implants which failed, so she has been through this process before and now having to go through it again. I don't know the details of why, but most likely it was, and I can see, for example, around this implant here on this side, the positioning, the quality, the materials that were used just were subpar, and so as a result she lost all of the implants that were placed, and it just creates a lot of problems for patients. So here at Trust Implants, we like to do, as they say in construction, measure 3 times, cut once. That's exactly what we do here as well. We measure, we measure, we measure, we anticipate, and we plan accordingly so that we can achieve optimal results and success that patients can be happy with and that can protect their investment long term. So from the materials that we use to the planning, all of it is tied together and allows for long-term success. That implant, and then over here we've got bone to work with, but we're losing it because the teeth are causing bone loss, and as a result we're losing that bone here. And then this implant here, we've got bone to work with now. If we wait too long, we won't. Same thing over here. And so what this software does, it allows me to do the surgery on the computer before I do it in your mouth, okay? And so similar situation here, and then back here in the upper jaw, again, I have to do a sinus graft in order to get this to work. And then on the bottom, we would be placing these implants to give you a fixed permanent set of teeth that don't come out. If we can do all of this, it's just a matter of you spending the time and brushing and maintaining it. But we'll give you back your second molars in the back, all the way to the second molar, so you'll be able to chew and eat, and then it'll look beautiful, of course. So this is an idea as to how the surgery would go about, how many implants we would be placing, and then from there we would just need to figure out, how to take the next step and move forward. So, do you have any questions about the X-ray or about the treatment itself?
Actually, right now I have
No,
no idea about
no.
that. Yeah, but
Okay.
just find the good way to do for mine.
The best way, yeah.
The best way, yes.
If you have your cell phone, you can take a picture of this, so you that way you have an idea kind of what we're talking about, you know. These red lines here, that's the nerve, that's the inferior alveolar nerve, so that way we know where we're at, and yeah. Okay.